folks, welcome back to the reading room. I'm going to talk to you today about a 6-year-old Great Dane that presented for lameness of the left thoracic limb. So radiographs were taken of the antebrachium, and here they are. What we notice is at the distal radius there is a lesion centered in the metaphysis. It's characterized by a combination of increased opacity. So I'm just going to kind of zoom up on this a little bit. We've got increased opacity and then regions of decreased opacity as well. We also have evidence of there being periosteal reaction along the margins of the limb. So the question becomes, what is this? Well, I think we can play a little bit of presumption based on the breed and the location, and this is an osteosarcoma. But what are the features of this radiographically that point to that? Well, remember that aggressive osseous lesions really only need one of our aggressive features to be able to be called aggressive. So this one's on the earlier side. It's not that exploded bone with the crazy periosteal reaction or anything like that, but there is evidence of lysis going on here. This heterogeneity, this lucency through this region here is not normal, and then the adjacent sclerosis with the periosteal reaction. Osteosarcoma has to be at the top of our list. The less likely differential diagnosis for something like this would be a fungal osteomyelitis, and what we need to do is sample the bone. So we can either take a bone biopsy, or if there's evidence of a cortical break, we can use ultrasound to guide a fine needle aspirate into that area. So biopsy is going to get us our definitive answer, and then of course the next step would be thoracic radiographs or CT for staging purposes, and abdominal ultrasound for staging purposes. So I hope this has been helpful in identifying some of the more subtle aggressive osseous lesions. This is an aggressive osseous lesion of the distal radius in a dog.